Thank you guys so much for coming. So I'm Laura Rice. I'm an associate professor at the University of Illinois Urbana-Champaign. I know we have one super fan, Illini fan in the audience back there. So thank you. All right. So as Dave said, I'm going to be talking about a newly developed scale outcome measure to assess fall concerns among individuals who use wheelchairs and scooters. Okay, so fear of falling is something that we're interested in investigating, and kind of by definition, this is an ongoing concern about fear of falling that can limit participation. So looking at the data, so among individuals with a variety of different health conditions, in a survey that my research team did, we found that about 63% of individuals report a fear of falling. And that actually, like, just having the fear itself isn't that bad. I mean, I have some healthy fears about, like, when I go skiing or riding my bike or something so that I don't get injured. But really what the concern is here is that when people limit activities that they would like to do, that they need to do in their community. And we did find about 50% of the people who did report that they had a fear were limiting those activities. And then some additional research that my team did, we did look at comparing people who reported a fear and those who did not report a fear. And we found that those people who did report fear of falling had lower quality of life and also lower reports of community participation. So this is something that we want to intervene on. So the good news is that we can intervene related to fear of falling. So we have done actually multiple studies where we have done comprehensive fall prevention and management intervention. And so I'm just pulling some results from our last trial. This is a 6-week online hybrid fall prevention and management intervention. I don't have time to go into the details of the study today, but I'd be happy to tell you more about that program later on. But among 12 individuals living with multiple sclerosis who use wheelchairs and scooters, we did see a significant reduction in fear of falling after they participated in the study. So how did we measure that? So we did both qualitative and quantitative measures. So we did interviews with participants after they finished the trial, and we talked to them about their fear, and we did find pretty consistently people were reporting that they had less fear. So for one example is here, I'm less afraid because I know like how to maneuver my transfers better. And then we had another participant who talked about having more confidence to go out into the community, go to a swim meet that his child was participating in. In addition, though, we did do a quantitative measure as well. We used the spinal cord injury fall concern scale, and we did see a significant difference both pre and between the start of the intervention and right after the intervention, and then pre-intervention to 3 months post-intervention. But as you can tell from the name, this outcome measure to assess fear of falling has only been validated among individuals living with spinal cord injury who use wheelchairs and scooters. So this has been actually an ongoing problem for us for a while, and this is a major limitation of this outcome measure. So we were really interested in developing a new outcome that could be more comprehensive for a variety of people living with different health conditions who use wheelchairs and scooters. So I'm just going to back up a second and talk about the spinal cord injury fall concern scale. So this scale was developed in 2010, and it has 16 items to assess a variety of different activities of daily living. Probably in the back, you cannot see this, so I apologize, but it asks things about kind of transfers to different surfaces, pushing wheelchairs on different surfaces, doing different activities of daily living. And I will note it was only validated also among manual wheelchair users living with spinal cord injury. And it's a pretty basic 4-point Likert scale, but they tested 125 participants during their initial session and then had 20 people follow up about 2 days later. And they found pretty good reliability and validity for this outcome measure. So we saw a need, though, to develop a new outcome measure. First of all, for the population, we also wanted to have a measure that could be used among people who use wheelchairs and scooters living with a variety of different health conditions. But in addition to that, we also felt like some things were missing from this outcome measure. So we wanted to expand it. And also, as I kind of talked about at the beginning, fear of falling isn't always a bad thing. So we wanted to be able to quantify a little bit more kind of how the people were feeling, what their experiences were when they were performing these different daily activities of daily living. So to go through this process, we took several steps. So the first thing we did use the SCI Fall Concern Scale as a foundation. We did reach out to the authors several times, but we weren't able to connect with them because we wanted to involve them in the process of the revision of the outcome measure. But what we did is we took out the items specifically related to spinal cord injury. And to be honest, there weren't that many that were very highly specific to spinal cord injury. And also we worked to expand different factors, include different factors that were found to be associated with falls among individuals who use wheelchairs and scooters. So after that, we made our initial revisions. Then we showed this to a group of stakeholders, 5 individuals who primarily were researchers, mostly people who were on our research team. A lot of these people were also clinicians, and one individual was an individual who uses a wheelchair full time. So we got feedback from this initial group of stakeholders and made some revisions to the tool. Then our next step was to actually take this out to some focus groups of people outside of our research team. We did 2 different focus groups. Our first one was among 7 clinicians and researchers. And then we also did a focus group among 10 individuals who use a wheelchair full time, living with a variety of different healthcare conditions. And some of their feedback was that the instructions were not very clear. They wanted also more examples of some of the activities that we were asking about. In addition, we at first had a section on leisure and exercise activities, but the participants, both groups, actually felt like that was just too big of a concept to be evaluated in an outcome measure like this. So we ultimately decided to remove that from the measure. So we came up with a measure that now has 33 items. So we pretty much doubled the outcome measure. And so we are kind of similar things, though, but more in-depth assessments related to dressing, bathing, toileting, laundry, cooking, and cleaning, and then bed mobility, transfers, reaching, using transportation, and then also both pushing and driving. So it would be applicable to individuals who use power wheelchairs as well on a variety of different surfaces. So with 33 items, it's hard to show the full outcome measure. So I'll just give you an example of what one of the items looks like. I don't think you can see the cursor up there. So the first section is very similar to the old SCI Fall Concern Scale. So we're asking the person to evaluate how much concern they have with a specific activity. So this is an example of getting dressed or undressed. And then the participants are providing a response on this Likert scale. And we also added a do not perform option on the original version of the tool. It told participants if they didn't perform that activity to kind of envision their level of concern with that. But we didn't feel like people had a good sense of kind of envisioning that. So we just have a do not perform. So that kind of takes it out of our assessment. But then, because again, as I was talking about, fear of falling is a very nuanced thing, we really wanted to get more information about the person's fear and kind of what they're doing with these activities. So we're asking questions if they use physical assistance while performing the activities, and then also what type of assistive technology they use, and then having kind of an open-ended question to give us more details about kind of what some of their concerns are. And what our vision, what our vision is that this top part would be the quantitative part, that would be the score, and you would get an end score of all the items on the tool. It would just be simply summing up the responses on the Likert scale. But then these bottom 3 items would be something more that a clinician could use if they were interested in kind of going deeper into understanding more about the person, what type of assistive technology they use. They're kind of more detailed about their concerns so that they could guide their interventions better to help manage fear of falling. Okay. So looking at the results, so we'll talk about our inclusion criteria as well. So we enrolled participants with a variety of different health conditions who had at least one fall in the past 3 years, and use a wheelchair or scooter for at least 75% of their mobility. So we had 174 participants. The majority of them were males. Their average age almost 40 years old. And we had participants representing a variety of different health conditions, including spinal cord injury, multiple sclerosis, Parkinson's disease, muscular dystrophy, and a variety of other different health conditions. The majority of our participants were power wheelchair users, but we also have manual wheelchair users and scooter users represented as well. So the first thing we did was we looked how well the scale was correlating with the current SEI fall concern scale. And we did see a pretty good correlation between the 2 measures. Looking at the internal consistency, we also found that this was very high. When we looked and also looking at adding and deleting different questions from the outcome measure really didn't change the internal consistency too much. And we also found fairly decent retest reliability. We compared the participants took the measure at a baseline session, and then we asked them to repeat it again in approximately 1 week. And then we had the participants repeat again in 6 months. And we saw fairly good reliability over those 2 time points. So looking at this measure itself, so this will be a really important item for both researchers who are examining different intervention programs to help manage fear of falling, but also for clinicians as well, because there, other than the SEI fall concern scale, there's really not much out there to evaluate fear of falling. And as I talked about at the beginning, this is a pretty significant problem. So moving forward for us, one of our biggest items that we are interested in investigating is if we can reduce the scale down a bit. So it does have 33 questions. It did take our participants about 20 minutes to complete the outcome measure. So that's pretty long. So we want to see if we can start to reduce down the number of items, but still get good results, and certainly some additional psychometric analysis looking at the predictability related to the outcome measure to predict fear of falling. All right. I'd be happy to answer any questions you might have. Okay, yep.
In relation to reducing the number of items, did each item have all those extra components?
Yes.
Plus.
Yep. So each item has kind of those 4 responses. If the person reports that they don't perform the activity or they don't have any fear with that activity, so it's in red cap, so it's kind of based on the participants' responses. If they say that they don't perform or they don't have any fear, they don't get those extra questions. So it does streamline the process a little bit. But yes, if they report fear with all of those, they are asked to respond. We did make that as an optional item though. But yeah, we definitely know it's a long measure, and that's something we'd like to reduce down.